All right, welcome to the Binge Eating Disorder Workshop series. This is our third workshop this year, Recovery from a Health at Every Size Perspective. My name is Danny Gillity from the Eating Disorder Foundation, and I'm delighted to welcome everyone here tonight. Today's workshop is brought to you in collaboration with the Eating Disorder Foundation and Eating Recovery Center, Pathlight Mood and Anxiety Center. The Eating Disorder Foundation was founded in 2003 with a mission to be an effective resource in the prevention and elimination of eating disorders through free and accessible education, support, and advocacy. We are a Denver-based foundation that is now serving individuals and families both nationally and internationally. The Eating Recovery Center is a treatment center that provides hope and path to recovery at all levels of care. ERC has on-site treatment options as well as virtual options, and Pathlight Mood and Anxiety Center provides exceptional care for mood, anxiety, and trauma-related disorders. Their experienced clinicians and staff are committed to providing an integrated treatment approach to address common behavioral health concerns. You can find more information about what these organizations offer with the links that I'll provide in the chat in a few moments. I want to take a moment to thank everyone who contributed a donation upon registration. The Eating Disorder Foundation is able to provide free and accessible services because of donation like these. And I'll put the donation link in the chat if you are interested in making a donation at some point this evening. So thank you again. If you have questions for our presenter, I invite you to use the chat feature to communicate with me directly throughout the workshop. The chat is kept confidential and will come to me directly. We will save time for Q&A after the presentation, and I will deliver those questions to Meredith. If we don't have time to get to all the questions, we will include them in our follow-up email. We will not be sharing the PowerPoint, however, we are recording and will send the recording as soon as possible. All right, so for our speaker this evening, Meredith Nisbet is a licensed marriage and family therapist and a certified eating disorder specialist. She is currently the supervisor of the clinical response team with ERC and Pathlight Mood and Anxiety Center, where she engages with patients and families and providers seeking admissions nationwide. In addition to her work at ERC Pathlight and in her private practice with Three Bird Counseling, Meredith provides education and training on weight stigma and health at every size informed care around the country. Meredith earned her bachelor degree from the University of North Carolina at Chapel Hill and her master's degree from East Carolina University. Meredith resides in Raleigh, North Carolina, where she spends her free time listening to true crime podcasts, practicing hot yoga, and snuggling with her dog, Mac. So Meredith, thank you for presenting tonight. We're so lucky to have you here.
Thank you. I'm so excited to be here. So tonight we are talking about binge eating disorder, recovery from a health at every size perspective. If you're not familiar with health at every size, that's okay. We're going to give a brief overview. And if you're super familiar with health at every size, that's great. We're going to keep it short and sweet so we can move on to some of the more exciting content for tonight. So a little bit about me, like Danny said, I'm the supervisor of the clinical response team with Eating Recovery Center and Pathlight Mood and Anxiety Center. I've been working in the eating disorder field for about 6 years and really feel very lucky to be able to turn my passion for caring for folks into a career. I am currently a certified eating disorder specialist and working on my supervisor credential, which means that I've really dug deep into the eating disorder world, into all of the literature that we have, and have spent a lot of time in clinical practice. Of course, I don't know everything, nor does anyone. And so I always like to acknowledge that we're all always learning. And part of this work of being a clinician is unpacking your own biases, taking a look at, your positioning in the world and any blind spots that you might have as you work with other people. And so I invite you to help me in that journey of continuing to learn. You're not only here to learn from me tonight, I'm also here to learn from you. And so I'd like to extend that invitation and acknowledge that we're all always working towards learning more. So tonight we're going to talk about weight stigma and complex trauma and how these things are significant drivers of the development of binge eating disorder. We're going to talk about health at every size, or HAES. I'll use those terms interchangeably, and the social justice applications to eating disorder treatment and recovery. And then we're going to discuss kind of a development of your personal recovery narrative. So what kinds of skills will be helpful to you as you seek to either attain or sustain recovery, and what that recovery might look like for you. Just a quick note on language. Throughout this presentation, you'll hear me use several terms that sometimes can be off-putting to people. One of the big ones is the word fat. When I use the word fat, I'm using it as a neutral descriptor. So rather than in a derogatory way, similar to tall, short, old, young, this is a movement within the fat community to reclaim something that has been used towards folks of size for a long time. This can be very triggering for people. And so I just also want to extend the invitation that if these words aren't for you, fat, person of size, person in a larger body, if those words don't resonate with you, that's okay. I always extend the invitation to folks to use language that is comforting to them to describe their bodies. If that's not how you identify in your body, that's perfectly fine. These are the words that I prefer. And so they're what I will be using tonight. The words that I don't prefer to use are fat, obviously when it's used derogatorily, but also the words obese and obesity. And the reasoning for that is because the words obese and obesity are rooted in the medicalization and pathologization of bodies. And it can be really triggering for larger bodied folks who have had negative healthcare experiences. And so we'll stay away from those words tonight. But what is health at every size? Health at every size is a social justice movement that is aimed at increasing equitable access to good healthcare for folks of all shapes and sizes. There's five main tenets of HAES. So we'll go through those really quickly. The five main tenets of HAES are weight inclusivity, which means that we're going to accept and respect the diversity of body shapes and sizes. And we're also going to reject the idealizing or the pathologizing of specific weights. Health enhancement, which means supporting health policies that improve and equalize access to information and services, and also personal practices that improve human well-being, including paying attention to individual physical, economic, social, spiritual, emotional, and other needs. Respectful care. This is the most important one for providers like myself. It's so important that we acknowledge our biases and that we use our privilege as providers to work to end weight discrimination, weight stigma, and weight bias. We should be providing information and services from an understanding that socioeconomic status, race, gender, sexual orientation, age, and other identities impact weight stigma. So we have to be looking at the intersectionality of folks' identities, and we need to be supporting environments that help address inequities within these. Eating for well-being and life-enhancing movement are the last two tenets of HAES. These two are particularly challenging or stressful for folks who are in recovery from an eating disorder or who have an eating disorder, because they're dealing with two things that run rampant in eating disorder culture: food and movement. Eating for well-being is this idea that we want to promote flexible, individualized eating. And that means eating in a way that is based on our hunger and satiety, our nutritional needs, and also pleasure, rather than any sort of externally regulated eating plan for weight control or weight management. With eating for well-being, it's sometimes called intuitive eating or gentle nutrition. And the caveat with eating for well-being is that we don't promote eating for well-being, intuitive eating, gentle nutrition for folks who are in active treatment for their eating disorder or who have active eating disorder symptoms. It's usually recommended that about 6 months to a year of stable recovery has been passed before you start to work on some of those intuitive eating principles. And that's really because, in the midst of an eating disorder, we can't really access some of these things like hunger and satiety. The idea of food as pleasure, or loss of control around food. There's a lot of variables there that make eating for well-being a more challenging aspect of HAES for folks with eating disorders. That doesn't mean it's not accessible. It's accessible to everyone, but at what time is the question. And so I always encourage folks to talk with their treatment teams about, is intuitive eating right for me right now? What might intuitive eating look like for me right now? And to really keep open communication around that. The other thing, with life-enhancing movement, we want to support physical activity that allows people to engage in movement to their ability, if they want to, and to enjoy what they're doing. So rather than doing an exercise routine that we feel like we should be doing, that we don't like, that is painful, finding things that you love to do that make you feel good, that meet your abilities where they are, and giving yourself the space to choose if you want to engage in movement or not. This is another piece that can be challenging for folks with a history of an eating disorder. And so again, really keeping your treatment team or your therapist or your family and friends involved in discussions around, is this right for me? Is it right for me right now? What might it look like? A lot of misconceptions about HAES exist. And so I always like to talk about, what is health at every size? Health at every size is all of these things, but what isn't HAES? What are the misconceptions that exist about health at every size? So HAES is not healthy at any size. So it's not about body size correlating to health. It's really more about the narrative that controls how we pursue health. It's also not ignoring people's health or telling people to just do whatever they want. HAES promotes overall health and well-being, and we're using evidence-based science to really expand this current narrow definition of health that we have to one that is functional for and respectful of all people. So we're looking to bring more to the table. HAES is also not just for people in larger bodies. People of all shapes and sizes really benefit from health at every size principles, and from taking a more social justice approach to their health. This approach really shifts the focus to acknowledging and respecting individual people's circumstances. And the goal of this is to work to investigate and support options that are available to help make choices that benefit health and well-being. Improving a person's health is a process that begins by contemplating what it would take to make certain determinants of health available and accessible to different people, and not by pathologizing any specific weight or thinking that we can know someone's health status or the way they eat or the way they move just by looking at them. So what drives binge eating disorder? There's a lot of things. The first one being genetic loading. So this just means we know that eating disorders are heritable, and scientists have identified several genes related to binge eating disorder specifically. So there may be something, binge eating disorder may run in your family. You may have a specific gene that triggers binge eating disorder in combination with any of these other things. So the next one on the list, social placement, or what I call intersectional identity. So we know that BIPOC folks have a higher risk of eating disorders. We know that trans folks have a higher risk of eating disorders. Folks in low socioeconomic status have increased risk of eating disorders. And this is because where we are in the world matters, and not just geographically, but where you grew up, the community that you grew up in, your relationship with the world, any kind of marginalization that you experience, all of these things have the potential to drive your risk for an eating disorder. The next thing would be trauma. So binge eating often functions as a means of dissociation or distress tolerance. And it's actually a very resilient coping skill when it's developed. For a lot of people, the only way that they know to cope with what they've been through is to bring the attention to their body, to bring their attention to food, and to do something that soothes that trauma. And so we see tons of experiences of folks who are truly using binging as a means of dissociating from their body because they've experienced somatic or body-based trauma. We also have biology. So if you're someone who has a history of weight cycling, where you're constantly losing weight, gaining weight, losing weight, gaining weight over and over again, we know that that primes you to increase your appetite. The same thing with cortisol reactivity. The higher your stress is, the more cortisol there is in your body, the higher your appetite will be. And then also starvation mechanisms. Your body is always going to fight to return to its set point, and that set point might change over time. But when you enter starvation mode, you're going to crave highly palatable and energy dense foods. Your body is trying to survive. And so again, with the idea of resilience, we are all trying to survive all the time. And so if you have experienced something that your body thinks or your mind thinks is not survivable, whether that is trauma, whether that is entering into starvation mode, your body is going to do whatever it can to help you survive that instance. And so just wanting to really highlight that there's a lot of shame around eating disorders, but particularly around binge eating disorder. And I think it's really important to share with you that any sort of coping mechanism that you have developed in order to survive is a piece of your resilience. Now, that doesn't mean that that coping mechanism is always going to work for you. It doesn't mean that it's always the best coping mechanism for you. But I think that we should have some compassion for ourselves and acknowledge that we're all doing the best we can with what we have. And so if this, if your eating disorder is a coping mechanism that you developed to survive something, even if it's not serving you anymore, even if it's something you're really struggling with, it's okay to have compassion for that piece of yourself that went through what you did and developed an eating disorder as a result of that. The next thing on this list is psychological restriction. So when we think about psychological restriction, this can often trigger binge eating. And then, of course, unknown or other factors. So things we don't know about yet. All of these things can drive binge eating disorder. You may have some, all, or none of these, but this is a little bit of insight into how this happens. And again, wanting to highlight that, binge eating is not a moral failing. It's not something that you just need to get control of. This is something that really comes from an intersection of a lot of different factors. Some of them that are social, some of them are social environmental, some of them are endogenic, meaning that we're looking at things like genetic loading, biology, psychological things. All of this to say that you don't develop binge eating disorder because you don't have any self-control. You develop binge eating disorder because you are primed to do so for any or all of these reasons. Today, I'm really going to focus on social and environmental factors. We could talk about the genetics and the biology for days, but I usually do that with a partner, a medical doctor who's a little bit more schooled in those things than I am. So I'm going to focus on the social and environmental things. And when we talk about social and environmental aspects that really impact the development of eating disorders and binge eating disorder in specific, we have to talk about weight stigma. So weight stigma, there are two kinds. We have externalized weight stigma and internalized weight stigma. Weight stigma that is externalized is general societal bias towards people in larger bodies, and this shows up in all kinds of ways, but mainly healthcare, employment, and education. We know that in healthcare, many physicians associate larger bodies with poor hygiene, noncompliance, hostility, dishonesty, and a lack of self-control. They spend less time with larger body patients, and they're less inclined to order diagnostic tests when those are indicated. These are all things that have been found in the literature. In employment, we know that people in larger bodies are more likely to have difficulty finding and keeping employment. We know that they'll experience lower wages for the same jobs or performance as other folks, and that they have lower promotion prospects than their counterparts. And in education, we know that children in larger bodies often experience what we call peer rejection in the school environment. And what we actually see in the literature is that before children start kindergarten, if we ask them to rate their self-esteem levels, they're pretty high. However, shortly after starting school, we see a really drastic drop off in levels of self-esteem. And the literature finds that self-esteem is lowest among overweight children who believe that they were responsible for their weight and who also believed that their weight was the reason for having fewer friends or being excluded from games and sports. And this is an example of kind of how externalized weight stigma really leads to internalized weight stigma. Internalized weight stigma is a product of weight-based attributions made about yourself. And this is often dramatically impacted by having a lived experience of externalized weight stigma, where when you have these experiences, when you hear those words or those experiences over and over again in your head, you begin to take that into yourself and really kind of merge that with your identity. And the struggle with that beyond, just feeling poorly about yourself, we can't just chalk that up to self-esteem. We have to really look at how that impacts people. And so what we find is that people who have internalized weight stigma have a drastically increased risk of hypertension, eating disorders, metabolic syndrome, depression, diabetes, cortisol reactivity, and weight gain. So weight stigma doesn't just impact our feelings or our self-esteem, it impacts our physical health. And this is really important when we are talking about an eating disorder that is often painted as lack of control, living in a larger body, doing this to yourself. We have to look at all of these other factors, weight stigma being a really large one, that impact that. So why is weight stigma relevant? So we know that behaviors that attempt to control weight, so restricting your food intake or compensatory things like purging or compulsive exercise, these things are present in and they also affect the development of eating disorders across diagnoses. But we're not talking about all diagnoses tonight. We're talking about binge eating disorder. And so while a lot of folks with binge eating disorder don't identify as engaging in restriction, it's really common for folks with binge eating disorder to also be trying to control or manage their weight and or control or manage their binge eating behavior based on a fear of weight gain. Restriction or energy deficit doesn't always drive binge eating disorder, but it's really important to consider the impact of both physical and psychological stress related to weight management. So we know that just the fact of being mindful of calories raises cortisol in the body and causes psychological stress. So even if you're not counting your calories, even if you're not logging them, even if you're not actively attempting to lose weight, being mindful of that increases psychological stress in your body. And we know that for folks who are experiencing loss of control eating, like in binge eating disorder, or folks who are in a larger body, these folks are often encouraged to either restrict intake, lose weight, or both. And so if we see someone who is restricting their intake, starts restricting, and then it begins to experience ongoing binge eating as their body's survival response to the starvation, sometimes providers miss this totally. They miss the restriction that's driving the binge eating because it's not something that's seen as problematic for somebody in a larger body. And this is just not true. And this is really an example of weight stigma at play where, if I go into my doctor and I'm really struggling with binge eating disorder, loss of control eating, and my doctor is seeing weight gain or weight change from that behavior, the response is, you really need to lose weight. You should eat a certain number of calories a day. I start to do that and my binge eating increases. And then I feel like I failed, right? I feel like, why can't I get a handle on this? I just need to have more self-control. But the truth of the matter is that this is, it's a mental health disorder. It's an eating disorder. And so if we're looking at the way that weight stigma and eating disorders interplay, we're seeing this reinforcement of behavior that actually drives the eating disorder. Weight stigma also increases shame and guilt related to food in the body, which is a key diagnostic factor for binge eating disorder. So just the fact that you are feeling shamed or experiencing stigmatizing experiences for the way that you're eating or for the size of your body, that's going to increase shame and guilt around food in your body, and that again is going to drive the eating disorder and could possibly be the thing that helps get you a diagnosis. The big thing here as well is that individuals in larger bodies are 2.5 times more likely to engage in some form of disordered eating behavior than individuals with a quote unquote normal BMI, but they're only half as likely to be clinically diagnosed. And so what we know is that for folks in larger bodies, the impact is really significant. We're falling through the cracks and we're going without this affirming evidence-based treatment. We're not getting diagnoses, we're not getting treatment. And that's a large section of the population that is suffering in silence. You know, binge eating disorder is the eating disorder with the most prevalence in the US population. And that's a huge section of people that aren't getting diagnosed, aren't getting treated, aren't getting help. And so that I think is something to highlight as well. So why HAES? Why does it matter? HAES is pivotal in eating disorder treatment because it gives us a compassionate social justice-based framework to understand and unpack systems of power. Systems of power contribute to development and maintenance of eating disorders. So we need a way to look at this so that we can figure out how to undo it. There are really significant genetic and neurobiological predispositions that play a role in the development of eating disorders. But again, we're talking about systemic environmental factors today. So when we talk about macro and micro systems of power in the development and maintenance of eating disorders, the macro piece of that is institutionalized fat phobia / weight stigma, which is born out of racism. So weight stigma shows up in education, interpersonal relationships, transportation, the workplace. We've talked about a lot of examples of how weight stigma shows up in life. But this macro system of power is really something that kind of upholds the development of an eating disorder because it's reinforcing these ideas everywhere you go, every experience you have, right? So, you know, again, if you are someone who is struggling with binge eating disorder, you're experiencing weight stigma, you're feeling shame about your body, you're feeling shame about food, you've experienced trauma and you have loss of control eating, and someone says like, hey, you need to lose weight. You start restricting, your binge eating increases, and here the cycle goes again. So looking at that macro piece of weight stigma really being relevant to the development and the maintenance of binge eating disorder. We also have to look at the microsystems. So microsystems are things like intergenerational fat phobia, what we learn from our families and our roles within them, and then how we make meaning about our bodies and how we carry that throughout our lifetimes. And we'll talk about that a little bit more in a second. Another reason that health at every size is so important in treatment is because we're talking about weight stigma as somatically based complex trauma. Weight stigma is a form of complex trauma because complex trauma is present in multiple settings. It occurs repeatedly over time, and it really increases the internalization of messages that contribute to negative self-talk and self-image. So over time, as you have this repeated trauma experience and response, you're going to feel unsafe in your body. You're going to feel unsafe in public. You're going to feel unsafe interacting with other people for fear of rejection, shame, and judgment. So we can see how this complex trauma develops and then how it kind of keeps itself going, especially with the weight stigma impacting it as well. This somatically based complex trauma can lead to attempts to modify the body through dieting or exercise, a reluctance to present the body in public, so not wanting to go out, not wanting to eat in front of other people. It can also lead to dissociation from the body as the source of the trauma. So like we talked about earlier, the idea that trauma can drive binge eating disorder because binge eating is a form of dissociation. And that's where we're looking at body-based or somatically based complex trauma. It can also lead to increased guardedness or decreased connection with other people, and in turn, avoidance of medical or mental health care, which is really difficulty engaging and being vulnerable with providers and having low distress tolerance for triggers because of this repeated re-traumatization that feels like it is in every aspect of your life. So Intergenerational fat phobia. This is a term most people have probably not heard before. I am a licensed marriage and family therapist, which means that all of my psychotherapy training is from a systems perspective. Systems theory, the basic idea of systems theory is that everything in a system, so if you think about a family, everything in a system is both impacted by and impacts everything else in the system. So if it's you and your mom and your dad, everything your mom does impacts you and your dad, and everything you and your dad do impacts your mom. So everything is both working on and being worked on by everything else in the system. So when we conceptualize families this way, we can really see how these narratives within the family reinforce any sort of mental health diagnosis that's going on, right? So like the way that you're interacting within your family can make things better or it can make things worse. So the way that I work with families in therapy around their eating disorder or the eating disorder of one member of the family is doing the work to conceptualize family belief systems around food and body size, body shape, or weight. So what this means is doing a really comprehensive interview with the family and saying, tell me what food means to your family. Tell me what your culture says about food. Tell me what that means to you. Tell me what beliefs you have about, what good bodies are, what bad bodies are, what good people are, what bad people are, and really exploring those narratives and trying to understand how that's feeding either positive or negative things for whoever the identified client is. We need to understand the function of those belief systems. So what are they upholding within the family structure? What power dynamics are they playing into? Who do they harm? Who do they benefit? We have to really get intimate with that and get to know and get curious about these things, because our families are where our identity is born. And so our beliefs about our bodies are an extension of beliefs about ourselves. But these beliefs are formed within the context of our family system. So if we don't understand how we developed these beliefs or how we were given these beliefs, it's hard to understand how we can unpack some of those driving factors of the eating disorder. Identity development doesn't exist in a vacuum. We don't just pop out one day with a full-blown identity crisis. This is something that happens over time and over interactions with family on the micro level. And then, of course, we have macro level weight stigma, genetic predisposition, things like that. So self-esteem as an individual concept doesn't really serve us well. We need to know who you are. We need to know where you came from. We need to know what your beliefs are. Who taught you those beliefs? Have you, what do you think about them now? We have to really get to know that in order to unpack the things that you're carrying with you that might be contributing to your eating disorder. So redefining recovery. Is there a standard definition of recovery? Depends on who you ask. I say no. I don't think there's a standard definition of recovery. There are standard definitions for stability, for medical stability, for behavioral stability, for mental stability. There are pretty clear definitions for all of those things, but there's not a standard clear definition for recovery. And I think it's really important to say that, because when we have a standard for recovery or a definition for recovery that isn't attainable, it's something that's always out of reach. And we end up in a shame cycle that we can never quite get to where we want to be. And so my goal for redefining recovery is to make recovery more accessible. And one of the questions that clients always have, when we talk about treatment, when we talk about recovery, is, does recovery mean that I'm never going to binge eat? I would say my answer to that is also no. That can be discouraging to folks, but I reframe that as, we have to understand that binge eating, the phenomena of binge eating or loss of control eating, is something that is actually very normal in human behavior. So everyone binge eats at some point or another. Everyone will, everyone has. This is a normal piece of human behavior. It happens. where that crosses over into binge eating disorder, there's a very clear set of criteria in the DSM for when that happens. And so if your recovery definition is that you will always have control of your eating, you will never emotionally eat, you will never binge eat ever again, it's always going to feel like you're never doing recovery right. And so I want us to really think about defining recovery in a way that is accessible, in a way that improves your quality of life. So, how do we add more to your life? How do we increase connection with other people? How do we decrease your shame? How can we be kinder and gentler with ourselves? How can we care for ourselves from a holistic point of view? How do I define what recovery means for me? Well, let's think about those questions. How can I encourage myself to connect with other people? Could I take a mindful self-compassion break to combat some of this shame that I'm feeling? Can I be okay with, eating my cultural foods, even if it means I want more of them? What does that mean for you? I talk a lot with clients about defining health and wellness for them, for that individual person. And I think it's really important to acknowledge that health and wellness are multifaceted, and they're not the same for everybody. And so you have to think about what's important to you. So, we have to understand that health and wellness is social health, it's mental health, it's emotional health, it's physical health. There's a whole plethora of things that make up this idea of health and wellness. And health and wellness are not the size of your body or the way you eat. Or if you have an eating disorder, or if you're in recovery, or if you haven't gotten to recovery yet. Health and wellness are not black and white definitions. They're not dichotomies. Health and wellness are spectrums, and they're different for everyone. And so you have to decide, what does health and wellness mean to you? And using that, like, how do I define recovery? Like, if I have a binge episode, can I have compassion for myself? Can I be kind to myself so that I don't get trapped in this shame spiral and feel absolutely horrible? Or for some people, recovery does mean that they binge eat very infrequently. It looks different for everyone. And I think when you're thinking about how do I define what recovery means for me, one of the things that is really helpful is a DBT value sort. And you can just Google DBT value sort. There are tons of online options for value sort cards. But really getting down to the root of what's important to you can help you decide, how do I prioritize what recovery means for me? What do I care about? What's important to me? How can I add more to my life? And thinking in that direction helps you figure out, what does recovery mean for you personally? A few recovery tools. So we're going to kind of run through internal tools, so tools for you, environmental tools, and then relational tools. So internal tools are going to be things that help you either A, interrupt behaviors, or B, interrupt cognition, which is what we refer to as the last mainstay of the eating disorder. So if you're someone who really struggles with behaviors and then you're able to reduce or totally cease your eating disorder behaviors, you may still have eating disorder thoughts, eating disorder urges. And those are, again, the last mainstay of the eating disorder. So you may have those for the rest of your life. They may be louder or quieter at times. But when we're looking at interrupting these things, behavior and cognition, there's a couple of tools that are really helpful. So mindfulness is a big one. It's also a hot topic in the therapy world right now, and social media about therapy. Mindfulness is great. Excuse me. I like the app Insight Timer. It's free. There's a ton of meditations that are guided, not guided, about breathing, not about breathing, all different time limits. That's a really useful tool for mindfulness, for meditation, for kind of bringing yourself back to center. With interrupting behaviors and cognition, it's always so important to have compassion for yourself. So if you are familiar with Kristen Neff's work, her last name is N as in Nancy, E as in Edward, F as in Frank, F as in Frank. Kristen Neff's work on mindful self-compassion is fantastic. And she's got some meditations online and some activities and books that she's written that allow you to have a mindful self-compassion break. So when something something has happened, you're feeling really shameful, and you are having the urge to engage in an eating disorder behavior, taking a mindful self-compassion break can be really helpful to interrupt that. Also, the concept of opposite action. So if you are having an urge to do something, trying to decide if that's in line with your values or not, and then doing the opposite action if it's not in line with your values. Distraction activities can also be really helpful. I always love to tell people to have a phone a friend at the ready. If you have someone that you are open to sharing your struggles with and they are open to being there for you when you need something, having somebody that you can text or call and find out, what their kids are up to, what they're up to, share a little bit about what's going on for you. You don't have to talk about the struggles that you're going through unless you want to. You can just use that to distract yourself and to take a minute to come back to center before taking any sort of action. That is also a form of co-regulating, which I'm a huge fan of. I'm an attachment-based therapist, and so I think co-regulating is fantastic. If you have a partner, a family member, a friend that is willing to be with you in that moment of struggle, and do what feels helpful for you at that time. So telling, reassuring you, you are good, your body is good, I love you, I care for you, things that you need to hear in that moment. That takes a little planning and a little more open conversations. You may not be ready for that yet, but that's something that can be really great if you are at the place that you're able to be vulnerable and open to connecting with someone in that way. When we look at environmental tools, we have things that help cultivate a supportive recovery environment. So some of my clients really struggle with being triggered when they look in the mirror, or when they have a fight with their significant other, or all of these other different things that happen in our environments that we don't really have any control over. So it could be as simple as something like, if you really struggle with looking in the mirror, cover it with Post-it notes temporarily. If you're feeling triggered by social media as you're scrolling through and you're seeing the curated highlight reel of everyone else's life, refine that. Who are you following? What are you watching? What are you reading? I would really encourage you to diversify your worldview and diversify your circle, and look at what you're taking in, because that can often feed what you're struggling with. When we're looking at relational recovery tools, we want to also consider treatment as a relational recovery tool. But one of the most important things you can do is find and create community. So whether that is in a support group, whether that is with family and friends, you really will need that community as you're finding and sustaining recovery, whatever that means to you. This can also look like boundary setting with family, friends, and providers. If you're interested in learning how to set boundaries with your family and friends around the holidays, we'll be doing another talk in the fall all about that, called HAES for the Holidays. So you're welcome to tune in to learn more about that then. But being able to say when a conversation is uncomfortable for you, or when you don't want to talk about somebody's diet, or when you're having a bad body image day, being able to set those boundaries is really important in advocating for yourself in your supported recovery community. Another thing that we don't talk about nearly often enough is advocating for yourself in the treatment environment. Being able to set boundaries with your providers and share with them what you're needing in the moment, and making sure that your providers are folks who are accountability supports, who can provide compassion when you're really struggling to give that to yourself. Advocating for yourself to access care and using that tool to further your recovery journey. And when we're talking about accessing care, I always think it's really important to reiterate that insurance companies' definition of sick enough is not actually indicative, excuse me, of physical or mental wellness and or the need for support or treatment. So if insurance won't authorize your care, if you keep getting denied or declined or stepped down, that doesn't mean that your disorder is not valid. It doesn't mean that your struggle is not valid, and it doesn't mean that you don't need support. And so I think being able to step outside of that into your support community who can acknowledge like you are deserving, you are sick enough, you are struggling enough to be deserving of treatment, whatever that may look like for you. So here are some resources. I'm going to leave the screen on this just for a minute in case you would like to either screenshot or write down any of these. On the left, we have Instagram accounts that I think are really great for diversifying your feed and having positive recovery validating content on your social media. Those are on the left. On the right, we have podcasts and books. I think all of these are approachable both for patients and providers. So I think they're great. If, you know, these are things that both if you are a HAES veteran, they're great for you. If you're somebody who's brand new to HAES and you want to learn more, these are also fantastic. All right, and I can come back to that later if anybody needs to grab anything else, but thank you. Now we have some time for questions.
Thank you, Meredith. That was amazing. I just in the chat was just full of, is this being recorded? I have so many questions and I want to go back and listen to it. So thank you for providing such useful and important information to be having this conversation with us. So I want to start out, somebody wrote in about just trying to explore the best ways to support adolescents and how do we have these conversations with our young kiddos and not shaming them or making them feel bad, of course, and then also don't want to not speak with them because that doesn't feel right either. So if you have any, I know this is a big question, but tools, tips, or anything for just working with younger kids.
Yeah, absolutely. So I'm not sure, maybe you can clarify, Danny, are they asking specifically about adolescents with binge eating disorder or more adolescents around like body image and not wanting to body shame?
I mean, I think it's kind of both, but this person wasn't around binge eating disorder.
Okay, perfect. So the really unfortunate thing is that binge eating disorder, there's not much treatment for folks under 18 with binge eating disorder in terms of like higher level of care treatment centers. But it's something that shows up a lot in like primary care offices or in outpatient therapy where someone is struggling with binge eating disorder and maybe their medical provider who is really worried about like significant weight gain or, you know, other markers that they're looking at like blood pressure, cholesterol, things like that, is saying like you have to lose weight in order to be healthy. And so I think it's really important to set boundaries with providers. If health at every size is an approach that you're interested in, boundaries are so important here in asking that your child's weight not be discussed in front of them and in really looking to provide a supportive recovery environment for them. A lot of this with binge eating disorder is going to be about emotion regulation. So we're looking at trauma, we're looking at, you know, being able to regulate their emotions and kind of process things that are happening for them. So any kind of like DBT emotion regulation skills can be really helpful. But as far as talking to your kid about binge eating disorder, about body shame, weight stigma, things like that, I think it's really important to be honest with your kids and just to say, you know, there's a lot of stigma associated with being a certain body type, and that's wrong, and we don't believe that. And so we're working to combat that, and we want you to know that like we trust that your body is good. We trust that your body is going to do what it needs to do for itself. And we're here to help you with that. So if that means we're helping you with emotion regulation, that's what we're working on. If that means that, you know, we are going to work with a health at every size aligned therapist who can specialize in binge eating disorder without promoting weight loss, maybe that's what that looks like. But I think really validating your child's experience that it's tough to live in a larger body. It's tough to be a child in a larger body. It's tough to be a child in a body that is constantly changing and changing oftentimes in ways that are deemed unacceptable or bad by their medical provider, by their peers at school. You know, I think it's really important to just be honest with them and say, this is really hard, but validating that you love and respect them and think that they are a good person and know that they are a good person regardless of the size of their body, because the size of their body is the least interesting or important thing about them. And also that you can be healthy and pursue health regardless of what the shape or size of your body is. So you don't have to lose weight to be healthy. You can, try a different sport. You can, make sure that you're getting enough protein so you're full all day. Like, there are so many other things, and that is a very short cliche list, but there are so many other things. You can go to therapy, you can do meditation, you can really get engaged in your community. And we know in the literature that doing all of these other things are health promoting behaviors and do actually have an impact, a positive impact on physical health. And so having that conversation with them that, losing weight or restricting your food intake or getting control over your body is not actually what makes you healthy or the only thing that makes you healthy, even if that's what you're hearing from other people.
Yeah. Great. Thank you for that. I think it's an important conversation to be having. And I think we could do a whole workshop on just adolescence and binge eating disorder. So thank you.
Okay.
Something that came up multiple times from multiple people, and I'm not sure that this is even really a question, but just stating individuals wanting to be able to advocate for themselves at the doctors, and that's where they're feeling the most shame. The doctor not validating their experience and just going right to, you need to lose weight. And so just wanting to ask, if there are a few tidbits, of just like things that they can go into the doctors with in your tool bag to be able to just like have a conversation or stop the doctor from going down that road pretty quickly.
Yeah, absolutely. So one of my favorite resources for folks who ask this question is to direct them to Reagan Chastain. Her name, so I can't put it in the chat because it only goes to EDF, but it's RAGEN. And then the last name is CHAS as in Sam, TAIN. And the name of her blog is Dances with Fat. And so if you Google Dances with Fat doctor's office, she's got some cards that she created that are just phenomenal, because on the front, they introduce your medical provider or your clinical provider to, hey, I'm your new patient. I work from a health at every size approach. Here's what that is in a nutshell. And then here's what I expect from you as my provider. I expect you to respect my body autonomy. I expect you not to body shame me. I expect you not to focus on weight loss as the primary treatment for anything I'm struggling with. And then on the back, it has a bunch of links to peer-reviewed research. So if your medical doctor is like, what is this HAES stuff? I've never heard of this. Like, this is just like some wacky social justice movement. Like, no, there's actually peer-reviewed literature on the back of that. So your doctor, if they're willing, and I would hope that if you're seeing them, they would be, can go and plug that into the DOI and pull up that literature and take a look at that. And whether or not they agree with that, you are asserting your beliefs and your expectations for care at the beginning. I think that that is a really important thing. It unfortunately, with the power dynamics of healthcare, treatment, any kind of provider, the power dynamics are so rampant. And I think it often makes people feel like they don't have a say in the care that they receive. And I really encourage people to speak up for themselves if they feel comfortable. Because if you think about your interaction with a provider as someone who you are paying to receive a service from, you deserve to have that service be respectful, be comprehensive, meet your needs to the best of that person's ability in that interaction. And so if you are able to reframe this doctor patient, therapist patient relationship as something that, like, here's the baseline of the type of care that you deserve, and to make those expectations known to the provider, that's either going to rule out that provider as not a good fit for you and on to the next, or it's going to help that provider open up their worldview a little bit and maybe educate themselves a little bit more, think a little bit critically, or it's going to confirm that that provider is the perfect fit for you. So I think those are all benefits to really asserting your needs and your expectations of respectful, comprehensive care.
Thank you for that. And I put that in the chat. So, and people are putting in some different helpful things that we can include in the follow-up email as well. So thank you for that. So someone wrote in about when their eating disorder thoughts are loud. This person feels like there's a hierarchy of eating disorder behaviors, with binging being the worst. And they explain that this is something that is a similar experience with their peers and things that they have talked about, and wondering if you've seen this experience, if you felt it with your clients, and just also the cultural component that comes along with that.
Yeah,
speak
absolutely.
that a little bit.
There's such a huge cultural component to that. And I think we really can trace that back to weight stigma, where when we're looking at eating disorder diagnoses like anorexia, bulimia, OSFED, ARFID, things where oftentimes the medical side effect of the eating disorder isn't weight gain. Those eating disorders socially, not for folks who struggle with them, not for folks who are in the treatment realm, but socially struggling with restriction or purging or food avoidance, over exercise, a combination of those things, that is generally more socially acceptable than having an eating disorder where you feel loss of control over eating, you're eating large amounts of food, maybe you're gaining weight, maybe you're having medical side effects from that. There's a lot more shame around that. And when we explore, well, why is that? Why is that the very worst eating disorder you can have, or the very worst symptom you can have culturally and socially? It's because of weight stigma. Because at all costs, at any cost, we don't want to be fat, or we're taught or told that we shouldn't be fat, and that's the very worst thing you can be. It's the very worst thing you can do is have loss of control around food. And I think it's really important to look at the cultural aspect of that, and again, to have compassion for yourself, that if you have this thought that like binging is the worst thing I could possibly do, to get curious about that. Where does that come from? What is that rooted in? And also to be compassionate to yourself, because again, we don't form our identity in a vacuum. We are all programmed by the society and the culture that we live in. And we live in a pretty ill society and culture in a lot of ways. And so you have to do the work to deprogram that. And for some people, that means treatment. For some people, that's therapy. For some people, that's, reading and discussion. It depends what we're talking about. But I think having some compassion for yourself and knowing that that automatic thought that binging is the very worst behavior that you can have, not that it's good that you have that thought, but it makes sense, right? Like in the culture and the society that we grow up in, that is what your brain associates with that.
Wonderful, thank you. Do you want to take one more question? We're have a minute left.
Yeah, let's scoot it in.
Someone wrote in around just wondering if there's a difference between emotional eating and binge eating. I think sometimes we hear that word kind of getting thrown around, and just wanted to hear your thoughts on that.
Yeah, totally. There's definitely a difference. So when we're talking about binge eating, we're talking about something that has been clinically quantified. So while the definition is a little vague, we do have a standard definition for what a binge eating episode is and what it consists of. Where with emotional eating, I think emotional eating, it depends on who you ask, but to me, emotional eating is something that we do all the time, right? Like on my birthday, when I have a piece of my favorite cake that my mom makes, or like when we celebrate someone's birthday, or when you go home for Thanksgiving and you have like that favorite item or dish that your grandma makes, like food is associated with emotion in most cultures. And I think that that's a good thing. It's a healthy thing. It helps us connect with people, connecting around the dinner table, connecting at holidays, connecting at social gatherings. Food is really the nexus of all of that. And so when we're talking about emotional eating, that's often used as a way to say that like, oh, you can't tolerate your emotions, and so you have loss of control eating. Now, is that true? Sometimes, yeah, for some people, but that doesn't necessarily mean that eating with emotion or eating for emotional reasons is bad. It means that we have to look at that for that person. So is that a destructive, negative behavior for that person? Maybe. Is it a destructive, negative behavior for everyone? No. And so we have to really look at that on an individual level. If what you're calling emotional eating is something that's really detrimental to your life, to your ability to engage in social relationships, to your mental health, then that's something that you might want to process in therapy. But yes, those things are very different things, where one is, clinically defined, clinically significant, and the other is a phenomena that happens all the time and is pretty neutral and can be good or bad depending on the person, whether that's destructive or detrimental to them or not.
Wonderful. Well, thank you.
Yeah, you're welcome.
Meredith. Thank you everyone for attending. Again, we will be sending out the recording and get to the questions that we didn't get to. So thank you all, and hopefully we'll see you next time.
Thanks. Good night.
Thank you.